Hello, hi, Dr. Thaper here at Superhero Lifestyle. Today I wanted to spend a few minutes talking about insurances in the nursing home population, and this is strictly for California, but it may be similar for your state as well. So please look into that. The patients, when they come over in the nursing home, I feel like the families as well as the patients are very misinformed. They come from the hospital to the nursing home thinking that, first of all, they will have as many as 3 months because that's what their insurance told them, or that's what the social worker at the hospital told them. But the actual reality is that it could be as little as 3 days. Let me tell you how that works. Okay? The way to have days granted by your insurance, what they look at is continued improvement if they're strictly there for therapy, or if there's a medical need, such as if somebody is getting IV antibiotics, which they otherwise cannot get at home. Okay. Now, if there's a medical need, if they're getting an IV antibiotic, so the patient can stay if that antibiotic cannot be arranged for at home. So if they're there for 6 weeks of IV antibiotics and they're getting it like 3 times a day, their dose, then the insurance cannot send a nurse out to the home 3 times a day so the patient can have that antibiotic. So they allow them to stay there as long as the doctor has prescribed the antibiotic. But if somebody's getting once a day, and insurance feels like it's cheaper for them to send a nurse home once a day than have the patient sit in a nursing home, then they will just authorize you maybe few days after hospitalization if this patient is able to walk and use show that they can do their activities of daily living, like getting dressed, bathe, get in and out of shower, get out of bed. Then they can cut the insurance off and send the patient on their way. The most informed or most uninformed patients are the ones that are there for physical therapy, and they feel like they're there for as long as they need, as many as 3 months sometimes. Now, every time a physical therapist works with a patient, they document their initial evaluation and their progress. And every day that they're doing it, they're faxing their notes to the insurance. Insurance looks at it and they see as long as there's improvement or as long as there's a need. This is, please keep in mind that this is what insurance thinks that the need is, not what the physician thinks, or not, of course, what the patient thinks, is what the insurance thinks that the need is. So as long as insurance feels like there's a need, they will continue to authorize more days. But if the patient starts to plateau, where let's just say they're walking 50 feet one day and 3 days later they're still walking 50 feet, insurance can come in and say, okay, it's time to go home, and they can do that with a 48-hour notice. Most of my patients stay in the nursing home for the average 2 weeks. The national average is about 14 to 15 days. I think that is a good rule of thumb. Within 2 weeks, you can really give patient good rehabilitation, work on their activities of daily living, work on their medications so the patient can go home safely and not get readmitted to the hospital. And during this time, you make sure their medications are in order. You make sure that you've contacted the primary care physician, you set up all their home health, and you've set up their visits with primary care physicians so patient can go home in a safe manner and not get readmitted to the hospital. So this is something that I felt like I needed to share with the patients out there, with the families out there, because they come in with unrealistic expectations. So they should be thinking 2 weeks or not 2 or 3 months. I hope this information was helpful. For more informational videos like this, please subscribe to our channel, Superhero Lifestyle. Thank you. Bye.